go directly to the hypothalamus. Okay, so I ignore the first 15 slides in this part. Okay, I will talk about the hypothalamus today. So first of all, you should know that. So let me only talk about one important thing. Here, the limbic system. So you know that we have some areas in the brain collectively called limbic system. So it has two parts, cortical part and some subcortical part, right? So the cortical part starts from the orbitofrontal cortex, subcallosal gyrus, then cingulate gyrus, then it returns this way, hippocampal gyrus, the anterior side we have uncus, right? So this is a cortical ring. So you can see this ring between the hemispheres on the medial side of the brain, right? And you have some subcortical areas, including the amygdala, hypothalamus, hippocampus, olfactory areas, septum, some nuclei in the thalamus, especially the anterior nucleus, right? And some portions of the basal ganglia, like nucleus accumbens, okay, ventral striatum. So these are part of the limbic system. So we have two definitions for the limbic system. One anatomical definition and one physiological definition. Anatomical definition is this: cortical and subcortical structures interconnected via some circuitous pathways that link the cerebrum with the diencephalon and brachus. So it's a link between the cerebrum and diencephalon and brachus. So anatomically, it is the definition of the limbic system. But physiologically, we say that the entire neural circuitry that controls emotional behavior and motivational behavior. So the networks in the brain responsible for emotion and motivation are called limbic system. So limbic system is responsible for emotions and motivation. Emotion includes these. Anger, sadness, happiness, fear, disgust, surprise. So these are some examples of emotion. These emotions are controlled by limbic system. Cortical ring, subcortical areas. Right? When we talk about emotion, we have some feelings, so we are aware that we are afraid, we are happy, we are sad, so we are aware, right? So this is called feeling, and it's conscious. We have some changes in the behavior. For example, when you are afraid of something, you escape. This fly is a behavior. There are also some physiological changes in the body. For example, cortisol is secreted, epinephrine and norepinephrine is secreted, sympathetic nervous system is activated, right? Heart rate increases, blood pressure increases. So these physiological parameters is also part of the emotion. So emotion has three parts: behavioral part, physiological part, feeling, consciousness. So when we talk about emotion in physiology, we mean this one. Changes that happen in the physiology of the body. So, actually, experiments in order to discover the centers responsible for emotion was started by these two guys, Kluber and Dietz. Heinrich Kluber. Wait, actually it wasn't my breakthrough. Did you know this?
Yes.
And Paul Dietz. I think it was earthquake. So they removed the temporal lobe of a monkey bilaterally. So they remove temporal lobe of a monkey on both sides. And they've seen some changes in the behavior of the monkey. Okay? They found these problems with the monkey. The first one was hypermetamorphosis. The monkey has extreme tendency, has extreme curiosity about everything. So it was very curious about everything. Okay? They call this hypermetamorphosis. The other thing that happened in this monkey was hyperorality. The monkey tended to put everything in the mouth and start to chew it. Okay, hyperorality. Dietary changes in the form of hyperphagia or eating inappropriate objects. Right? The other thing was hypersexuality. So the monkey has intense sexual drive toward inappropriate animals. And the last one was docility, which was a lack of concern for pervasively feared object. So the monkey actually showed lack of fear. There was no fear of anything. Okay, I told you that fear is one example of the emotion. So, when they removed the temporal lobe, one aspect of emotion was lost. Fear was lost. So this means that in the temporal lobe, we have some structures responsible for fear. So you can see the image here. So the monkey was operated, right? The temporal lobe on both sides were removed. So they put a plastic snake in front of the cage of this monkey. Usually the monkey is very scared of snakes. They never approach the snake, okay? But here you can see that the monkey doesn't show any fear. It can handle and manipulate the snake. And there was a break in front of the snake, and the monkey picked it up, put it in the mouth, and then start to play with the snake. So this shows that this monkey is not afraid of the snake, doesn't show any fear. So removal of the temporal lobe causes loss of fear. So we call this Kluver-Bucy syndrome. Kluver-Bucy syndrome. The main important part is this lack of fear, right? Okay. Which part of the temporal lobe is important for fear? Experiments show that amygdala is very important. So in the temporal lobe we have hippocampus, amygdala, and the cortex. Amygdala is the main part responsible for fear. So in this experiment they did a very good experiment here. So a mouse is here, they played a tone, right? So first, the mouse pay attention to the tone. I mean, the mouse thinks that it's important. Okay? So it holds the seal and doesn't move and pay attention to the sound, right? But when you repeat the tone, the animal learns that it's a neutral tone. It never harmed the animal, so it's not important. So after that, the mouse doesn't pay attention to the tone. Okay? But in another experiment, they played the tone. At the same time, they gave shock to the animal. So shock is painful. So every time they played the tone, they gave shock. Right? After a while, the mouse learned that this tone is very important because whenever it comes, after that, I got shock. Right? So, after a while, only with replaying the tone, you can cause fear in this animal. So, we call this fear conditioning. The tone alone causes fear. So, fear response in animal is with freezing. So, the animal freezes, it doesn't move, and show responses that are called fear response. Right? So, if you do the same experiment in an animal without the amygdala, the animal doesn't learn this. Okay? So, in order to learn this relation, the animal needs the amygdala. So, this experiment shows that the amygdala is the main and the most important part of the temporal lobe responsible for fear response, for understanding the fear. Okay? So the same also happens in some humans. For example, here you can see an MRI of a brain of a person called SM. Okay? So she's a lady that is still alive. She's living in the US. Okay? So it has a disease called Urbach-Witt disease. In this disease, neurons in the temporal cortex are calcified. So calcification causes neurodegeneration, so neurons are lost. But this doesn't happen in the whole brain. It specifically happens in the temporal. Okay? So in the MRI image of this person, you can see that. Okay, so this is the horizontal section. Okay, so this is the hippocampus. This is the amygdala. You can see that there is no amygdala here. So neurons here are lost. In sagittal sections, in frontal sections, these. You can see that hippocampus is there.
We can't see that.
But you cannot see this. Okay, sorry, this. Sorry. Okay, the amygdala is not here. Hippocampus is here. Again, in the frontal section, you can see that in the anterior side. Amygdala is lacking here. So, the person has a disease that causes loss of the amygdala, but no problem with hippocampus. Right? So this is similar to the other experiment here. Okay? So this guy doesn't show any sign of fear. You can search for that in the internet. Okay? You can search for SM, fear. Right? You can find the person and you can see the biography of this person. Okay? So there is no sign of fear in this patient.
We cannot master this fear. We cannot master this fear. We do not fear of anything by our.
Yeah, you cannot do this. So in this person, you mean?
No, I mean we are fearing all of. I mean so many things. So could you master the fear to not fear of anything?
So you mean that you want to learn not to be feared of anything?
Either an experiment, either any, something to not fear of anything.
Yeah, I know this. But I don't think so. Because in a normal person, when you have amygdala, okay, so you have the physiological infrastructure for being scared of something. Okay? So you cannot consciously suppress this fear. I think so. Maybe you can learn this, okay. So, but it needs a lot of practice maybe. Okay, but in physiological conditions, when we talk about physiology, we have the neural circuit for fear. So this fear circuit is not under our control. Okay, it functions subconsciously. Okay? So, these figures were presented to the SM, case XM, I mean. So you can see that some of these faces show fear, some others show disgust, some shows anger, some shows happiness, right? So you can see that there are different types of emotion in this face. And you ask the person to rate the level of the emotional state in each of these figures. For example, if a face shows fear, the person should give him a high rate, for example 10, right? Mm-hmm. But a low rate for happiness, sadness, and other emotions. Another face maybe is happy, So the person should give him a higher score in happiness and lower scores in other emotions, right? So this way you can see that patient SN cannot give higher rates of fear in these figures. Okay? So we can see that normal people give a higher score for afraid when the face shows the fear. Or they give a higher score for happiness when the face is happy. Or they will give a higher score for anger if the face shows anger. Okay? But you can see that the patient SN can give a higher score for happiness when it's really happy, a higher score for disgust when the face shows the disgust, but the person cannot give a higher score when the face is afraid. It means the person cannot understand fear, even in the face of others. So the person, the patient, cannot feel fear, cannot understand fear in the face of other people. If you ask them to draw something that shows fear, some faces that shows fear, so these are some drawing from the patient SN, right? So she can draw a happy face, a sad face, an angry face, but she cannot draw an afraid face. Okay? So this means she doesn't have any understanding of the fear. So, removal of the amygdala, both in humans and in animals, cause loss of fear. So, amygdala is important for fear, which is an aspect of the emotion. There are also some clinical relations between the amygdala and some diseases. Okay? So, in the psychiatric setting, you may have some patients that suffer from anxiety disorders. They include panic disorder, post-traumatic stress disorder, PTSD, generalized anxiety disorder, social anxiety disorder, simple phobias, obsessive compulsive disorder. You have heard these names, right? And in the note of this slide, there are some explanation about these. You can read them by yourself, okay? But from this list, it has been shown that amygdala is hyperactive when there is social anxiety disorder, or when there is PTSD. So the same region which is responsible for fear is hyperactive when the patient has social anxiety. For example, a person is afraid of going in front of a crowd and talk. Okay? So this is social anxiety. So it has been shown that in these patients, usually amygdala is hyperactive. So neurons are more active than normal. Or a person which has PTSD, post-traumatic stress disorder, amygdala is hyperactive. Okay? So, there are some affective disorders like major depression or manic depression. We call this bipolar disorder. You know this, right? So, major depression is abnormal sense of sadness, despair, and the bleak feelings about the future. There is disordered eating and weight control, disordered sleeping. So the patient has insomnia. Sometimes he or she may have hypersomnia. There is poor concentration and diminished ability to think. The patient may feel guilt, and there may be some feelings of worthlessness, diminished sexual interest, recurrent thoughts of death and suicide. Right? So all of these show major depression. So you may have a patient that doesn't enjoy at all. Okay? Always is depressed, feels bad, feels sad. Okay? And usually they won't eat enough, right? So they don't enjoy themselves, never, okay? So this is a case of major depression, if all of this happens usually, okay? So, another type of depression is manic depression. So the person shows sometimes major depression and some other time mania. Mania means happiness, right? So the person is extremely happy. So actually, happiness is only actually happens in the appearance, but inside the heart, by heart, the person is really depressed. Okay? So when there is two phases of major depression and mania, we call this condition bipolar disease. Okay? So experiments have shown that amygdala is important for major depression. So when you do functional brain imaging in the brain of a person with major depression, you can see heightened activity in the amygdala, orbitofrontal cortex, and also anterior nucleus, medial-dorsal nucleus of the thalamus. Remember, all of them are part of the limbic system. Amygdala, orbitofrontal cortex, in the anterior side, right? And some nuclei in the thalamus, medial-dorsal here, and also anterior nuclei, right? So you can see that three areas in the limbic system are hyperactive when the person shows major depression. So amygdala is normally important for fear, but when it's activated actually extremely high, then there will be some signs of major depression, or the patient may show anxiety disorders, right? So, let's see what happens at the level of the neurotransmitters when the patient have major depression. Okay, usually a patient with major depression has diminished formation of norepinephrine and serotonin in the brain. Which nucleus secretes norepinephrine in the brain? I told you yesterday. Nucleus. Rapid secretes serotonin.
So that's rare case. In the rare case, it's secreted.
In the what?
In the rare case, it's not so much related.
Yeah. No, actually, I'm asking you about two nuclei in the brain which secretes norepinephrine and serotonin.
I mean, it's also always secreted.
Yeah, they always secrete this. So rapid nuclei secrete serotonin, but locus ceruleus secretes norepinephrine. They are involved also in sleep and wakefulness. Remember? So in the brain they release norepinephrine and serotonin. If secretion is lower than normal, the patient may show signs of depression. Okay? So for example, Reserpine is a drug that blocks secretion of norepinephrine and serotonin. This drug causes depression. For treatment of patients with major depression, you can use some drugs that inhibit MAO. Remember that?
Yes.
Or some drugs called TCAs, tricyclic antidepressants. Or some other drugs called SSRIs, selective serotonin reuptake inhibitors. Or you can use some electrical shock to the brain called electroconvulsive therapy. All of them increase serotonin and norepinephrine. So, imagine that this is a neuron from locus ceruleus, which secretes what? Norepinephrine. Right? Norepinephrine acts on the postsynaptic cell through the receptor, alpha and beta. right? Then norepinephrine gets back to the synaptic junction. So we call this reuptake mechanism, right? Some drugs, like these, TCAs, tricyclic antidepressants, block the reuptake of the norepinephrine. So norepinephrine remains in the synapse, its activity gets longer, right? So in the patient, you have lack of norepinephrine or lower level of norepinephrine, you gave TCAs, you block the norepinephrine reuptake, the norepinephrine increases in the synapse, then the activity of the norepinephrine increases. You compensate for the lack of the norepinephrine. Another, norepinephrine is secreted, it acts, then it's degraded by monoamine active oxidase. We gave some inhibitors of this enzyme, so you inhibit this, norepinephrine remains. Right? I told you that major depression is also associated with loss of serotonin. So, if the neuron releases serotonin, 5-hydroxytryptamine. So serotonin acts on the receptor, right? And then it gets back to the axon terminal by way of some reuptake mechanism. So you can give selective serotonin reuptake inhibitors. Okay? So they block the reuptake of the serotonin, so serotonin remains in the synapse. The activity becomes longer. Right? When you give electroconvulsive therapy, you put some electrodes in the head, on the head, you give some brief shocks to the brain. So we call it ECT. After some sessions, after some shocks, usually the patient becomes better. This treatment also increases norepinephrine and serotonin. The mechanism is not known. How this happened, nobody knows. Okay? But usually the patients, the major depressive patients have suicidal thinking. Okay? They think of suicide. They want to kill themselves. Right? So, this is an emergency state in these people. And when they reach this situation, this condition, no drug is helpful. So these drugs cannot work anymore when the person reaches this stage, when they think of suicide. Okay? So in order to make them responsive to the drugs and decrease the thinking process, the suicidal thinking of the brain, physicians usually apply this one, ECT. By the shock to the brain, the suicidal thinking decreases, and also they become responsive to these drugs. From this point, they can respond to these drugs. So these drugs can act again. Okay? So bipolar disorder is associated with increased norepinephrine transmission. So decreased norepinephrine is associated with depression, but mania is associated with increased norepinephrine. So in this phase, some other drugs are used, like lithium. Lithium can be used in order to decrease norepinephrine and also the serotonin. By decreasing the norepinephrine and serotonin, you can stabilize the mood. Okay? So when a patient has bipolar disorder, in the major depressive phase, you can give these. In the mania phase, you can give lithium. Okay? Any questions so far? So, now let's talk about the hypothalamus.
Let's take a break, 5 minutes.
5 minutes, but a part of the limbic system, right?
Yeah.
So, the output signals from the hypothalamus go to 3 different directions. Some of them go to the brainstem and spinal spinal cord. Remember from yesterday's session I told you there are some nuclei in the hypothalamus responsible for wakefulness or sleep. They have connections with brainstem systems. Lucus nucleus, raphe nucleus, ventral tegmental area, substantia nigra. So all of these receive information from the hypothalamus. So some of the projection from the hypothalamus go to the brainstem or spinal cord, reticular areas. Okay, they may actually modify activity in the cardiovascular system, respiratory system, GI system, and also they may have some actions on the sympathetic and parasympathetic preganglionic neurons. So hypothalamus can affect sympathetic nervous system and parasympathetic nervous system. Some other fibers from the hypothalamus go toward the diencephalon and the cerebrum, like to the anterior thalamus and limbic cortex. So these are part of the limbic system, right?
It's nourishment.
Yeah. It's not working, right? It's not working. So, no, it's freeze again. So, some projections go to the brainstem, others go to the diencephalon and cerebrum, other information go to the infundibulum of the hypothalamus. They control the pituitary gland, right? So, hypothalamus can regulate vegetative functions and endocrine. Vegetative means functions that are necessary for survival, like breathing, like temperature of the body, sleep and wakefulness. So these are vegetative functions. So you can see the different nuclei in the hypothalamus, right? So this is the sagittal view of the hypothalamus. When you cut the brain like this, and then you can view the hypothalamus from the lateral side, you can see that some nuclei in this way. So this is the anterior part, posterior part, tuberal region. So in the anterior region you have these nuclei, the blue ones, right? Lateral and medial preoptic nucleus, suprachiasmatic nucleus. In the posterior side, you can see mammillary body, posterior area. In the tuberal region, you can see paraventricular, dorsomedial nucleus, anterior nucleus, ventromedial nucleus, supraoptic artery. So, anterior, paraventricular, supraoptic, dorsomedial, ventromedial, artery. So this is the lateral view, sagittal section. But if you have frontal section, like this, okay? So this is the fornix. Lateral to the fornix, you have lateral hypothalamus, then you have medial hypothalamus. Around the third ventricle, you have periventricular region. So you can see that in the lateral area, you have lateral hypothalamic area, supraoptic nucleus, and this is the optic tract. So two nucleus are in the lateral side. In the medial side, you have paraventricular, dorsomedial, ventromedial, and these. Okay? This is the anterior hypothalamic nucleus. But around the ventricle, you have arcuate nucleus and periventricle. So a nucleus can be in the tuberal region, anterior region, posterior region, when you view the hypothalamus from the lateral side. Or they can be on the lateral side, medial side, or periventricular side if you look at the hypothalamus from the anterior side. Right? Okay. So here you can see different functions of the hypothalamic nuclei. Like here, for example, you have medial preoptic nucleus. Right? The functions include bladder contraction, decreased heart rate, decreased blood pressure. this one, posterior preoptic nucleus. And in the anterior hypothalamic area, it can regulate body temperature, panting. You know panting? In the dog when they bring their tongue out and they do panting, okay? Sweating, tryotropin inhibition. Okay? So you can see that each of these nuclei has their own specific functions. So we'll see some of these functions in the next slides. So these functions were discovered by this guy. Okay? He won a Nobel Prize in 1949 because of his contribution to the discovery of the functions of the hypothalamic nuclei. Before this guy, nobody knew about the function of the hypothalamic nuclei because hypothalamus is located deep inside the brain. There were no access to the hypothalamus, so nobody knew about the function of the hypothalamus. But this guy put some electrode into the nuclei, stimulated the nuclei, and monitored the changes that happen in the behavior of that animal. This way, he discovered different functions of these nuclei. Okay, so you can see some of these functions. First of all, he found that stimulation in the posterior and lateral hypothalamic area causes increase in arterial blood pressure and heart rate. So, posterior area, lateral, increases heart rate, blood pressure. But stimulation in the anterior side, preoptic area, decreases blood pressure, heart rate. So, let's see. We have seen baroreceptor reflex in the previous part, right? So you know that sympathetic fibers go to the heart, they activate the heart, they increase heartbeat. But this sympathetic innervation is under the control of medulla, ventrolateral medulla, caudal ventrolateral medulla. Remember this? And also nucleus solitarius. Right? Remember that? So all of these nuclei are here. So nucleus tractus solitarius, ventrolateral medulla. And dorsal motor vagus can inhibit the activity in the heart by way of the parasympathetic fibers. But all of these fibers are under the control of the higher centers. Some of these centers are located in the cortex, others in the amygdala, others in the hypothalamus, others in the periaqueductal tegmental and parabrachial. So these regions can affect these regions. They can affect sympathetic and parasympathetic nervous system. This way, heart rate is controlled. So some of these centers are in the hypothalamus. Lateral, posterior, increase heart rate. Anterior side, preoptic, decrease blood pressure and heart rate. Another vegetative state or vegetative function is thermoregulation, regulation of the temperature of the body. So you know that the normal temperature is 37. It's always 37, but during the night it gets, for example, 36 degrees Celsius during the sleep. Okay? So this temperature is regulated by the hypothalamus. So to do this, hypothalamus receives information about the temperature of the body. The information comes from the skin, viscera, and some of the neurons can directly sense the temperature of the blood. Okay, so let's see. In the skin, we have thermal receptors, remember? Cold receptor, warm receptor, heat pain, and cold pain. They are important for temperature. So these thermoreceptors in the skin send signals to the dorsal horn. From here, some of the information go to the brain, spinal thalamic pathway. Some other information reaches the parabrachial nucleus. So parabrachial nucleus receives information about temperature. Then it sends the information to the median preoptic nucleus. Median preoptic nucleus. From viscera, we have thermoreceptors. Go to the solitary nucleus, parabrachial nucleus again, median preoptic nucleus. Median preoptic nucleus can also directly sense temperature of the body when the blood reaches this area. So, any change in the temperature of the blood may activate or inhibit neurons in the median preoptic nucleus. So we have some peripheral thermoreceptors and some central thermoreceptors. The central one is here, in the median preoptic nucleus. So, median preoptic nucleus receives information about temperature, directly or indirectly. What happens next? If there is any change in the temperature, increased temperature or decreased temperature. It sends corrective signals to the medial preoptic area. So median sends to the medial. Dorsomedial hypothalamus. From here they go to the rostral medulla. Right? Medulla can change activity in the sympathetic nervous system. How? In the lateral horn, intermediolateral horn, they have three ganglionic sympathetic neurons. They are activated. One of the functions of the sympathetic nervous system is to increase metabolism in the brown tissue, brown fat tissue. Okay? So brown adipose tissue is activated. Heat production increases. Right? So heat production increases temperature of the body. So, when you feel cold, when the temperature gets lower, median preoptic nucleus activate the rostral medulla through this pathway. Then medulla activate the lateral horn, the spinal cord. Sympathetic nervous system increases heat production by increasing metabolism in the brown adipose tissue. Another important thing that happens is that medulla activate ventral horn neurons, alpha motor neurons. They cause shivering, shivering. So shivering increases heat production. So this way temperature gets back to the normal level. Right? So you should know that. Thermoreceptors are in the skin, in visceral. They send information to the parabrachial nucleus, then to the median preoptic nucleus. The same nucleus is also the central sensor of the temperature. It itself can sense the temperature. Then it has connection with medial preoptic, dorsomedial nucleus, and rostral medulla. They increase metabolism in the heart, in the brown adipose tissue, and they cause shivering. Heat production increases.
Sir, blood temperature में क्या है? Blood temperature.
Break temperature.
Blood temperature.
Blood temperature. Yeah. So it can activate median preoptic nucleus directly. So blood has a temperature. It should be 37. Okay? If it's lower or higher, when it reaches the median preoptic nucleus, the median preoptic nucleus can directly sense the temperature. Okay? Another thing that hypothalamus does is regulation of the body water. So, lateral hypothalamic area is a thirst center. So, if neurons here are activated, they feel thirst. They will be thirsty. Okay? So, the person doing smoke. Okay? So, lesions here cause the person to stop drinking water and also sodium. Another thing is that paraventricular nucleus and supraoptic nucleus release ADH, vasopressin, which controls renal excretion of water. You know that they act on the distal tubule, they increase reabsorption of the water. So water remains in the body. Lateral hypothalamus increase intake. Right? So both water intake increase, water excretion decrease. So in the body we will have more water. Right? You can also see other pathways important for body water regulation. So, this is subcortical organ, you know that. Subcortical organ. And we have also organum, vasculosome, lateral, lamina terminalis. So these are outside BBB. They don't have BBB, blood-brain barrier. So, when there is decrease in the body water, right? So, amount of the fluid inside the body decreases, blood volume is decreased, angiotensin is secreted, right? By the renin-angiotensin system, exactly. So, angiotensin 2 increases in the blood. When the blood reaches here, there is no blood-brain barrier. So, angiotensin can directly activate neurons in the subcortical organ and OVL2 neurons, right? When they are active, they sense neurons to median preoptic nucleus. The same nucleus which is responsible for temperature regulation, right? So median preoptic nucleus is activated. It sends other neurons to paraventricular hypothalamus and supraoptic nucleus. These two release vasopressin. Paraventricular nucleus also is part of the system which causes thirst. So paraventricular nucleus, lateral hypothalamus, and paraventricular nucleus in the thalamus. Okay, all of them increase thirst. So by two different ways, the hypothalamus can increase body water. So I may ask you in your exam which nuclei are important for the regulation of the water. So you should mention, for example, in your test, you should mention lateral hypothalamus, which is the third center, paraventricular and supraoptic nucleus, which release ADH or vasopressin, median preoptic nucleus, which is the sensor here, right?
Doctor, we have allopurinol also to give the simulation of thirst. This nucleus, effect of this nucleus, PVH and lateral hypothalamus and paraventricular thalamus. We have allopurinol drug.
Allopurinol?
Yes. So this drug will increase the simulation of this nucleus.
I don't
and
know.
Also it's increase the thirst. And when I take this drug, I am so thirsty.
But I don't know about the mechanism of this drug.
Maybe it's like...
Okay? Maybe it affects this system or other system, we don't know. Maybe it doesn't have any action on the brain.
It can be like this?
Yeah, why not? For example, it can have some effects on the circulatory system or on the kidney.
So body, regulation of body
But,
water
yeah.
is not...
So do you know that the main function of this drug is to increase thirst?
Yes.
So this drug is actually ordered for increasing the thirst and drinking more water, you mean?
Yes.
So maybe it has direct effect on the system. Okay? For example, it may activate angiotensin system. I don't know the action of this drug. Allopurinol.
Yes. It's for gout disease.
For what?
Gout disease. G-O-U-T disease. G-A-O-U. G-A-U-T.
No, GOUT.
Disease.
Gout.
Okay,
Sir-
I also should look for that.
So SF4 nucleus, they will,
Subcortical organ.
yes sir, it will sense the level of angiotensin in the blood, sir.
Yes, it can actually be activated by angiotensin, or it can be activated by increased osmolality. Correct.
They are in the blood, no, sir, because you said that there is no blood barrier inside
Yeah, there is no blood-brain barrier, so blood can directly affect this system.
this system.
Okay?
Angiotensin is the construction.
So, the other thing that the hypothalamus does is the regulation of the feeding, food intake.
Hunger.
So, lateral hypothalamus area was thirst center, right? It's also hunger center. So activity of the neurons here increases both hunger and thirst. So the person seeks for food and water, right? So it's associated with hunger, so it increases appetite. Other nuclei like ventromedial hypothalamus or satiety center. So when these neurons are activated, the person feels food, okay? They feel satiated. So lesion here cause overeating. Mammillary body nucleus cause feeding reflexes like leaking of the lips and swallowing. So lateral hypothalamic area is hunger center. Ventromedial hypothalamus is satiety. Activation of the neurons in the ventromedial hypothalamus causes an animal or a person stops eating.
Fullness.
Yeah? So, another important nucleus in the hypothalamus involved in feeding is arcuate nucleus. Arcuate nucleus of the hypothalamus. It has two types of neurons. Some of the neurons express a peptide called POMC, pro-opiomelanoamine. Right? So these neurons express this protein. Other neurons express NPY, neuropeptide Y, or agouti-related peptide, another. Okay? So the first category of neurons are catabolic. The second one are anabolic. So catabolic neurons can inhibit lateral hypothalamic area and activate the paraventricular nucleus. Lateral hypothalamic area causes appetite and feeding, I mentioned here. Right? So they are hunger center. And paraventricular nucleus increases energy expenditure. So this one is activated, this one is inhibited. Energy is used, but intake decreases. So this class of neurons are catabolic because they decrease feeding, increase energy metabolism. Right? Another class of neurons are anabolic neurons, NPY neurons. They activate lateral hypothalamus, inhibit paraventricular nucleus. So they increase feeding behavior, they depress energy expenditure. So they are anabolic. Right? We get more food, we use less energy. Right? By the activity of this. You know the hormone leptin,
Yes,
right? From the endocrine system. It decreases the appetite.
It breaks down the fats.
So it's secreted from the fat tissue and it decreases the appetite. How it actually acts on this? So leptin activates PMC neurons, inhibits NPY neurons. So this system is activated, this system is inhibited. What is the result? This one is activated, so feeding behavior gets lower and energy expenditure gets increased. Okay? So leptin can decrease appetite and increase energy expenditure. Insulin also do this. Insulin inhibits the anabolic neurons. So lateral hypothalamus is not activated, feeding behavior decreases. Right? So, but you know also ghrelin. Ghrelin is secreted from the stomach. When? Just before the eating. Right? So, ghrelin from the stomach activate NPY neurons in the arcuate nucleus. They activate lateral hypothalamus, feeding behavior. So we will have more appetite, more food intake. Energy expenditure is inhibited. Right? So, in the hypothalamus, we have arcuate nucleus, which has two categories of neurons. POMC neurons and NPY neurons. POMC neurons are catabolic.
Catabolic. Yes, sir.
Right? NPY neurons are anabolic. They can affect neurons in the lateral hypothalamus and paraventricular. Lateral hypothalamus is a hunger center, so when it's activated, they increase food intake. Right? Paraventricular is nucleus responsible for energy expenditure. When it's activated, it increases expenditure. So these neurons can affect these nuclei, so this way they can regulate feeding behavior and energy expenditure. So this neural circuit is under the control of leptin, insulin, renin. So you can see that endocrine system interacts with the nervous system in order to increase or decrease appetite. Right? So this is the way hypothalamus regulates feeding behavior. So you should remember these names: lateral hypothalamic area, appetite center, ventromedial hypothalamus, satiety center, mammillary body, feeding reflexes, arcuate nucleus, and paraventricular. Yes?
Deficiency of leptin and insulin cause obesity.
Yeah. Any problem in the leptin system, the leptin itself or its receptor, causes obesity.
Therefore, the diabetic patients are mostly obese.
Diabetic patients are mostly obese. So let's say another way. Obese person have usually diabetes type 2. Right? So another function of the hypothalamus is the regulation of the uterine contractility and milk ejection. Oxytocin is released from the paraventricular nucleus. It increases the contractility of the uterus during the labor, right? And it also activates breast myoepithelial cells, which causes milk ejection. So hypothalamus is important for labor and feeding of the newborn, right? So, question?
Yes.
Yes.
Tutorial
So, okay. Usually the breastfeeding is facilitated by this system. Okay, so when the newborn suckles the nipple, okay, some neural information goes to the hypothalamus. In the hypothalamus, they activate paraventricular nucleus. Paraventricular nucleus release oxytocin. Where? Into the blood. Through the blood, oxytocin reaches the breast. It activates myoepithelial cells in the breast. They cause milk ejection. So after suckling the nipple, the newborn can receive the milk. Okay? So this is the neural endocrine reflex. So the sensory part is neural, the motor part is endocrine. Okay? So hypothalamus also controls secretion of hormones from the anterior pituitary gland. You know that the anterior pituitary gland releases a lot or secretes a lot of hormones. Growth hormone, LH, FSH, right? TSH, all of them. So, hypothalamus can regulate this secretion. How? For example, medial protic area releases GnRH, gonadotropin releasing hormone. So it can regulate release of LH, FSH, right? Paraventricular nucleus releases TRH, which stimulates TSH, thyroid stimulating hormone from the pituitary gland, right? Somatostatin.
growth inhibiting hormone.
So it inhibits release of the growth hormone, right? Somatostatin. Arcuate nucleus releases GHRH, growth hormone release. So it increases growth. Dopamine is secreted from the arcuate nucleus. So dopamine inhibits release of the prolactin. Right? So you can see that the endocrine system, I mean the anterior pituitary gland, is under the control of the hypothalamus. So nervous system controls endocrine system here. Okay? And the hypothalamus is the main area of the nervous system to do this. So another thing that hypothalamus does is controlling the circadian rhythm. What is it? So I told you that we have a lot of physiological parameters that change over time. For example, this is the body temperature. It should be 37. But during the sleep, it becomes lower, 36. And this happens all night. So in 24 hours of our day, we have 37 degrees Celsius body temperature, but during the night, it becomes 36, right? Another thing, growth hormone. It's always at a low level in the blood, but when we are asleep, it shows a peak, and after that, it comes back again to the low level. Okay? So every night, when we are asleep, there is a surge in the growth hormone level. Right? So this is repeated every night. Cortisol. So you can see that when we wake and when we actually get up, it's very high in the blood. Then there is decrease in the cortisol level. Okay? So this decreasing trend continues. When we sleep, it starts to go up. It reaches the peak just before waking up. Alright? So actually it's a stress hormone, so it prepares us for the stresses that we will have after getting up. Right? So this happens every morning. So these were only some examples. Cortisol, temperature, growth hormone. So every physiologic parameter changes over time, and these changes are fixed and happen every day. So we call these oscillations in the physiological parameters circadian rhythm. So how the temperature or how the growth hormone knows that what time is it now, and it should be low or it should be high. So for this circadian rhythm, we need some clock. Biological clock. So the biological clock in our body is suprachiasmatic nucleus in the hypothalamus. So it's an internal clock that regulates everything in our body. So the timing of everything in our body. So it sends actual information to all organs in the body. So organs are aware of the time of the day and the time of the night. Okay, so this way they can be regulated. So let's see.
Doctor, what if we slept at 2 p.m.? Oh, sorry, 2 a.m. and woke up at 12 p.m.
12 p.m.
Yes, 2 a.m. to 12 p.m.
2 p.m.
I mean sleep late.
Yeah.
And wake up also late.
So 2 a.m. you mean?
Yes, I said 2 a.m. to 12 p.m.
12 p.m. Okay, so if you do this regularly,
Yes.
okay, then this circadian rhythm may actually shift to your new lifestyle that you have. Okay, but if this happens only sometimes, then there will be an imbalance in the circadian rhythm. Okay, so for example, the cortisol is secreted at this time. Okay, so if you get up, for example, at 12, cortisol is not enough in your body because it shows its peak at 6 a.m. So you get up and the cortisol is not high in your blood.
That's why when we wake up at 12, there's So uncomfortable, yes.
Maybe, okay? So in order to live in a physiological condition, you should actually try to control everything. I mean, day and night, feeding behavior, drinking behavior, everything. So they should happen at the right time. Okay? So, suprachiasmatic nucleus has about 20,000 neurons. So it's very small. Okay, it has only 20,000 neurons. It's very few actually, right? So the firing frequency of these neurons follows an endogenous circadian rhythm. So, suprachiasmatic nucleus in the hypothalamus has 2,000 neurons. If you report from these neurons, they fire at some rates. Okay? So, for example, in the morning, it may have more firing frequency. In the night, they may have less firing frequency. So there is a circadian rhythm for the firing rate of these neurons. Right? So, they have connections with retina. You can see that they receive information from the retina. So when it's light, I mean when the environment is light or it's day, light is here, it activates the retina activates the suprachiasmatic nucleus. So it knows that now it's day, so it regulates the clock based on the light. If it's dark, it doesn't receive light information from the retina. So the suprachiasmatic nucleus can change the internal clock based on the darkness in the external world. Okay? So it has a clock which always works, no matter if it's dark or is light. Okay? But this clock can be regulated to day and night. Did you got this?
Yes.
Okay. So if you put a person, or if you keep a person in a room which is always dark for 1 month, for example, so there is no change in day and night. Okay? So internal clock continues to work. Right? But this internal clock is not regulated with the day and night. It works its own way. Okay? But when you receive information about the dark and light in the outside, then the internal clock can be regulated and can be matched to the light and to the dark. Got it? So, all other organs can regulate their works with the suprachiasmatic nucleus. But for every clock, we need some mechanism. For example, in this type of clock, we need some gears. You know gears?
Yes.
They always turn, you know, yeah. So this way, so you have gears. There is another gear here. Okay, so they turn. So this way they can keep the time, right? There is also some sand clock like this. Okay, sand come down. Okay, when they are finished, you can turn it again. And this way they can keep the time. So the time that it takes for all sands to come here is always the same. Right? So for each clock we need a mechanism. What about this suprachiasmatic nucleus? How they can keep the time. Okay? So there is a molecular mechanism for keeping the time. This is the cytoplasm of the cell, nucleus of the cell. There are some transcription factors called clock EMAL1. So these are two proteins. They bind together, they make a heterodimer. Right? Clock EMAL. This happens in the cytoplasm. Then when they are complex, they go into the nucleus, they bind to the genome. Okay? Then they regulate transcription of some genes. Two of these genes are CRY1 and 2, HER1 and 2. So period cryptochrome. Period cryptochrome. So mRNA is transcribed. mRNA gets out of the nucleus, they enter the cytoplasm. In the cytoplasm, they bind to the ribosome. Ribosome translates the mRNA into protein and protein. They make dimers again. The dimer come back again into the nucleus. In the nucleus, they inhibit clot and EMBL. So they are dissociated from the genome. So this dimer increase this one, but this one inhibit this one. Negative. So it has positive action on these, but this one has a negative action on these. Okay? So whenever we have high level of these, we will also have high level of these. But when it's high, this one decreases. So this change happens every 12 hours. So every 12 hours, one of the dimer is high, another dimer is low. Negative. After 12 hours, the other one happens. So the opposite happens. So this way, every 24 hours, we have a loop of these transcriptor factors and regulatory factors. Okay? So this way we can keep the time in the suprachiasmatic nucleus. Got it? So there is a loop of transcription factors that can increase the transcription of some genes. The product of these genes inhibits the transcription factor. So this happens every 24 hours. Okay? So this changes in the molecular level is translated into firing activity. So firing activity can be high or low. Okay? And then these neurons send connections to other neurons in the hypothalamus. So they can regulate body water, they can regulate body temperature, they can regulate sleep, they can regulate wakefulness. I mean the timing of these. They can regulate the timing of the growth hormone secretion, timing of the cortisol secretion, timing of the stomach function, timing of the kidney function. So every day at 12 or 1 p.m. you feel hungry. Okay, why this happens? Internal clock says the GI system that now it's a lunch time. Okay? So every parameter in the body is regulated with the internal clock. Where it is? Suprachiasmatic. How it functions?
By this transcription.
Yes.
So it means that when at 6
Yeah, corticotropin stimulating hormone. This one activates cortisol. Cortisol may have some feedback on these. Negative feedback. So this is one way of regulation of the cortisol. Another one is stress. So stress can directly activate CRH neurons in the hypothalamus. Another thing that can regulate the cortisol is the suprachiasmatic nucleus, circadian rhythm. So also other things. Okay? So several factors may actually regulate the level of the cortisol. So any physiological parameters can be regulated by internal clock also. Okay?
Sir, this system is auto-regulated. this system is auto-regulated.
Yeah.
It is regulating by itself.
Yes.
So how light is, Shudra said that light is controlling the circadian rhythm.
So,
How light is affecting the system?
so this molecular mechanism can be affected also by light.
How?
How?
Mhm.
Retina. In the retina, we have some ganglion cells that have a peptide called melanopsin. This is a chemical sensitive to the light. When light strikes the retina, melanopsin is activated. Some neurons in the retina are activated. They send information to the suprachiasmatic nucleus. So they release neurotransmitter onto suprachiasmatic nucleus. So neurotransmitter may activate receptors. Receptor may have some intracellular part, intracellular signaling, and this signaling may actually change the activity of this group. So this way they can cause some of these processes longer or shorter. Okay, so this way the internal clock can be matched with the light and dark out of the room. Okay, got it?
Yes.
Okay.
But during the darkness, in the absence of light, I mean, it's auto-regulated, right? It's auto-regulated. This
Auto-regulated. So when the light is lower, so the firing frequency in the suprachiasmatic nucleus is also decreased. So
But it works. Without light, it also works.
without light, yeah. So okay. So you can have, for example, a clock which always works, no matter what's happening outside of this clock. But there is a key here that you can use it for regulation. Okay, so you can change the time. So the same also happens in the suprachiasmatic nucleus. Suprachiasmatic nucleus has this mechanism. It always works, so it can keep the time. But light and dark can regulate this mechanism. Okay, so this clock can be matched with the light or dark. So how? Connection is by way of the retina. So we have retino-hypothalamic tract. We have glutamatergic neurons here. They release glutamate onto the suprachiasmatic nucleus. Glutamate may affect this process. Sexual drive is also controlled by the hypothalamus. Okay? So, anterior region and posterior region of the hypothalamus stimulate sexual drive. For example, medial preoptic area is the anterior part, has a role in male sexual behavior. They secrete GnRH. GnRH can cause secretion of LH and FSH, so this way they can regulate the reproductive system, right? It has also some behavioral effects, so like biasing the sensory processing to prepare sexually relevant sensory cues. So a neutral sensory stimulus can be perceived as a sexual stimulation, okay, by way of activity in the medial preoptic area. It can influence hypothalamic and brainstem nuclei, so they can regulate male sexual responses. So median preoptic nucleus. Paraventricular nucleus also contribute to the male sexual behavior. For example, it may have some pro-erectile effect, so it causes erection. So these two nuclei are important for male sexual behavior, but ventromedial hypothalamus controls female sexual behavior. It regulates fertility and sexual receptivity in females. So try to remember these: medial preoptic, paraventricular, ventromedial. So, the effect of lesioning in this area, okay, please read it by yourself, okay? You are out of time. So let me talk about brain reward system. So in the hypothalamus, we have some centers that are responsible for pleasure. When we enjoy, when we feel pleasure, these neurons are activated. We call them reward system. How we can find them? By this experiment. Okay? So we can put some electrodes into the hypothalamus or other areas of the brain. The electrode is connected with some pistol wire to the stimulator. The stimulator is connected to a key inside the cage. So when the animal presses the key, the stimulator turns on. It can send signal to the brain. So the electrode can activate the brain. Right?
So it's like dog under the ring. It's like dog under the ring. When they ring the bell and they give them food, after a while they just ring the bell and they saw that the dogs are leaking.
Yeah. So it's a kind of learning. We call them classical conditioning
Conditional doping.
or Pavlovian conditioning.
Yeah, it's just Pavlovian.
Yeah. This one is operant conditioning. So in the case that you mentioned, you have two stimulation, bell and food. Okay? But here, there is one stimulation, but one behavior. The behavior is pressing the key. The response is stimulation in the brain. So you can change the response here. For example, whenever the animal presses the key, you can give them food. So this way, you have relationship between a behavior and a reward. Okay? So we call this operant condition. So we will have this in the psychology. Okay? So, what happens if the stimulation here is pleasurable?
You will press again.
Keep pressing. Right? So if you put electrode into a special area of the hypothalamus, and you can see that the animal keep pressing the lever, it means that this area is a pleasure center. But if nothing happened, the animal pressed it and didn't actually repeat it, it means it's not a reward center. Right? So, this way, we discovered that, actually scientists discovered that lateral hypothalamic area and ventromedial hypothalamic area are reward centers. Stimulation here is pleasurable for the animal. So these nuclei are part of the pleasure network in the brain. Okay? You can do the same experiment with a reverse pattern to find punishment centers. Okay? Locations that the stimulation of the neurons cause punishment. I mean an aversion in the animal. Okay? A bad feeling in the animal. Okay? So these include periventricular zone of the hypothalamus and thalamus. Stimulation in these areas causes rage because they inhibit the reward centers. So rage is characterized by these symptoms: a defense posture, extended flows, lifted pain, so on. But these areas are under the inhibition of the ventromedial hypothalamus, hippocampus, anterior cingulate gyrus, and subcallosal gyrus. So we have some areas in the brain which are involved in pleasure, other areas that are involved in aversion. Right? So when neurons in the aversion system are activated, the person feels something like dislike. Okay? But when neurons in the reward centers are activated, the person feels pleasure. Got it? So why they are important for us? Let's see this one. We have this sequence of events: motivation, then we have action, then we will have reward. Motivation. What is motivation? We have talked about the body temperature, body energy, sexual drive, anything. Okay? So let's take the hunger. Okay? When we feel hungry and there is something to eat here, okay, we have motivation to eat that. Motivation means we feel some urge in order to eat that food. Okay? So we have internal need, external possibility. Okay? So this is called motivation. So hunger is a motivation. Motivation for what? Food. Thirst is a motivation for drinking. Okay, and so on. So when you feel cold, you have motivation for wearing more clothes. Blanket. Okay, so these are motivation. So motivation make us to do some actions. Action here is eating, drinking, wearing. Okay, but after that we feel pleasure. Right? After you eat, during the eat, you feel pleasure. So this is called reward. So first we need a need, right? That drive us to do an action. So we call this motivation. After the action, we feel reward. So all of this process is controlled by the brain. Motivation is controlled by hypothalamic areas. Action is controlled by motor cortex, premotor cortex, supplementary motor cortex, right? Then you feel reward, which is controlled by other hypothalamic centers, right? So the other thing which is important to know about this is that hypothalamus is a very small area in the brain, right? So we have seen that there are some neurons responsible for metabolism of the energy. If some neurons are active, we feel appetite. Appetite increases, we eat more. If some other neurons are activated, we drink. When other neurons are activated, body temperature gets higher or lower. Okay? So what does it mean? It means that we don't need to think about this. So for example, you never calculate the amount of energy that you have received before. So for example, you never calculate that, okay, during the breakfast I got, I don't know, this amount of energy. I've used this amount and I have only this amount. So I need more. So I should go and eat. So you never think about this. Okay? There are some small neurons in the hypothalamus. They are responsible for monitoring the level of glucose in the body or the level of glucose in the blood. If there is any decrease in the blood glucose level, they cause you feel hungry. So you eat. Or if nothing happened here, there is a clock that exactly at 12 or exactly at 1 p.m. tells you that it's now lunchtime. You should eat now something. Right? So the hypothalamus works at the subconscious level in order to shape your behavior, in order to regulate your behavior. And the whole bulk of the brain remains for other important things, for thinking, for judgment, decision making, problem solving, learning, memory. So these are important, right? So a small area functions at the subconscious level to regulate everything for you, so the rest of the brain can be used by yourself. Okay? So this is the importance of the limbic system, motivation system, reward system, so they can shape our